So today guys, we'll be reacting to a video of a patient who is probably in the first week or so after the hair transplant, and they're looking at their individual scabs and their crust coming off. So let's have a look.
Day 7 man on the fucking hair transplant. Look at that.
So you can appreciate the hairline that's been drawn. The good thing that you can see in this video, which is it looks like it's about 5 to 7 days after the surgery, is that you can see the individual scabs, which can be differentiated from one graft to another. And that's always a good thing, because if you have excessive bleeding in patients and the grafts actually start to conceal together, it makes it much harder for patients to actually wash and spray and take the scabs off. So that looks really, really good for what's been done. You can also see the donor area, and the donor area is one of the first things to grow back because the blood supply to the donor area is usually quite good. So you won't get much scabbing, but you'll start to see the tiny puncture holes where the grafts have been taken from, and they're starting to close up. So that looks fairly healthy to me.
It's doing really good. Most of the scabs have fallen off the back of the donor area.
Brilliant.
Scabs are starting to fall off here, but look how neat they are as well.
Yeah. So what you don't want to be seeing is patients having excessive redness, excessive dry blood on the skin, which basically means that they haven't been washing or spraying properly. So I'm happy with that.
You should never let them go completely crusty, you know? You're like really badly crusty. You should always take care of them, maybe hydrate them.
So it's a fine balance, because you want to hydrate the grafts in the first 2 weeks, but you also don't want to overhydrate. Sometimes patients put a lot of water into the scalp area after the transplant. And if you put excessive water, the fluid can go inside the channels and actually push the grafts back up. When the incisions close, you'll end up sometimes with what we call a cobblestoning effect. So just be careful. You do want to spray it, but you don't want to overdo it.
Maybe once a day, twice a day. You can see there as well.
Yeah.
Crusts are falling off the side.
So you can see the temple point work has been done on both sides. It's always harder doing the temple point work because you want to get the angle as flat as possible and the direction to follow the natural hairs on the sides. So it looks fine, but it looks like the angle could have been probably made a little bit more flatter.
The sides. Yeah, man.
We'd only really know once the hair starts growing out.
It's looking good. It's looking like a bit like Parmesan, but it's looking fucking good.
Yeah, it's good. We don't know how many days it is after the surgery. I can only presume it's about a week down the line, but the swelling is coming down, so yeah.
Filter on this just so you can see the donor area properly. But it actually does almost blend in with
the donor area, we get patients to take the bandage off within the first 24 hours. So after the first day is passed, you take the bandages off, you get the oxygen to start to heal the wounds. So in short, scabbing is a normal part of the healing process. Scabs need to be looked at ideally by the doctor or their clinic, just to make sure that they are crusting off as per normal. They're not taking out the grafts, so very important you don't rub your grafts out, and also to make sure that they are looking well hydrated, but just obviously, like we previously mentioned, not overly hydrated. In my practice, I always ask my patient to send me images after about a week after the surgery of the recipient site, and we can actually have a look at it and get to see if they are on the right sort of path in terms of their healing. And if they're not, we can always advise patients to come into the clinic and we can actually do the wash for them.